Homeopathy, a system of alternative medicine developed in the late 18th century by Samuel Hahnemann, operates on the principle of like cures like, suggesting that substances that cause symptoms in healthy individuals can be used to treat similar symptoms in sick individuals when diluted to a certain extent. While the efficacy of homeopathy remains a topic of considerable debate, proponents assert that it can effectively address various ailments, ranging from chronic conditions to acute illnesses. Understanding the diseases that homeopathy claims to cure and the proposed biomechanical mechanisms behind its benefits requires a nuanced exploration of both the philosophy of homeopathy and the scientific discourse surrounding it. One of the most commonly cited conditions treated with homeopathy is allergies. Homeopaths often recommend remedies like allium cepa, derived from onions, for symptoms such as runny noses and watery eyes. The biomechanical mechanism proposed for this treatment involves the idea of homeopathic dilutions triggering a response in the immune system. When a homeopathic remedy is administered, it is believed to stimulate the body's vital force, thus enhancing its ability to combat allergens. The stimulation may lead to a reduction in the hypersensitivity of the immune system, allowing the body to respond more appropriately to allergens rather than overreacting. Another area where homeopathy is frequently applied is in the management of respiratory conditions like asthma. Remedies such as arsenicum album and natrum sulfuricum are often used to alleviate symptoms. From a biomechanical perspective, it is posited that homeopathic treatments can help modulate the inflammatory pathways involved in asthma. By purportedly enhancing the body's self-regulatory mechanisms, homeopathy may help reduce bronchial inflammation and improve airflow. This is thought to occur through the activation of specific receptors that can modulate the immune response, thereby reducing the severity of asthma attacks and improving overall lung function. Chronic conditions like arthritis also fall within the purview of homeopathic treatment. Remedies such as Rhus toxicodendron and Bryonia alba are often recommended for joint pain and stiffness. The biomechanical explanation here involves the potential for homeopathic remedies to influence pain perception and inflammation. It is suggested that these remedies could stimulate the release of endorphins, the body's natural pain-relieving chemicals, thus alleviating discomfort. Additionally, the proposed effects on inflammation may stem from the modulation of cytokine production, which plays a crucial role in the inflammatory response. By balancing these cytokines, homeopathy aims to reduce both pain and swelling associated with arthritis. Homeopathy is also frequently utilized in the treatment of gastrointestinal disorders, such as irritable bowel syndrome, IBS, and gastritis. Remedies like Nux vomica and Lycopodium clavatum are commonly prescribed. The biomechanical mechanisms proposed for these treatments often focus on the gut-brain axis, a complex communication network linking the gastrointestinal tract and the central nervous system. It is suggested that homeopathic remedies may help to restore balance within this system, thereby alleviating symptoms. By modulating neurotransmitter levels and influencing gut motility, homeopathy could potentially reduce symptoms like bloating, cramping, and irregular bowel movements. In the realm of mental health, homeopathy is often employed to address conditions such as anxiety and depression. Remedies like Argentum nitricum and Ignatia amara are frequently suggested. The biomechanical mechanisms behind these treatments are less understood, but may involve the modulation of neurotransmitter systems, particularly serotonin and dopamine pathways. Homeopathic remedies are thought to enhance the brain's ability to regulate mood and emotional responses, possibly by stimulating neuroplasticity, the brain's ability to adapt and reorganize itself. This could lead to improved emotional resilience and a reduction in symptoms associated with anxiety and depression. Another interesting application of homeopathy is in the treatment of skin conditions like eczema and psoriasis. Remedies such as sulfur and graphites are often used. The proposed biomechanical mechanisms involve the regulation of skin cell turnover and the modulation of inflammatory responses. Homeopathic treatments may influence the production of cytokines and growth factors involved in skin health, leading to improved healing and a reduction in flare-ups. By enhancing the skin's barrier function and reducing inflammation, homeopathy aims to provide relief from the discomfort associated with these chronic skin conditions. While many individuals report positive outcomes from homeopathic treatments, it is crucial to acknowledge the skepticism surrounding the scientific validity of these claims. Critics argue that the extreme dilutions used in homeopathy render the remedies ineffective, as they often contain little to no active ingredient. The placebo effect, where patients experience real improvements due to their belief in the treatment rather than the treatment itself, is frequently cited as a significant factor in the perceived efficacy of homeopathy. However, proponents maintain that the holistic approach of homeopathy, which considers the individual's physical, emotional, and psychological state, is what sets it apart from conventional medicine. Despite the controversies, the popularity of homeopathy continues to grow, with millions of individuals seeking alternative treatments for various ailments. The appeal lies in its personalized approach and the emphasis on treating the whole person rather than just the symptoms. For many, homeopathy offers a sense of empowerment, allowing them to take an active role in their health and well-being. While the diseases commonly treated by homeopathy span a wide range, from allergies and asthma to arthritis and mental health conditions, the biomechanical mechanisms proposed for their benefit are still largely theoretical and not universally accepted in the scientific community. The ongoing debate surrounding homeopathy highlights the complexities of medicine and the need for further research to understand the potential benefits and limitations of this alternative approach. As the conversation around health and wellness evolves, homeopathy remains a significant aspect of the broader landscape of healthcare, inviting both curiosity and skepticism in equal measure.